this is Sydney Monica. Thank you guys so much for tuning into another episode. If you're new to this channel, don't forget to hit that subscribe button and hit the notification button so you can get notified every time I post a video. On this episode, we're going to be talking about the 10 top paid highest nurse practitioners. I'm going to run down their salaries, what they do, and the specialties. So let's get right into it. The number one top paid nurse practitioner would be home health nurse practitioner. And I say they're very underrated. A lot of people might not believe this, but these nurse practitioners, they work mostly with the elderly population, the geriatric that are sick and homebound. So they have to travel to these patients' home. And a lot of these practitioners, they're 1099 contracted. So they have that ability to make a lot of money, being that they can see as many patients as they want a day, depending on what the schedule can fit. And these practitioners, it's a very lucrative business. Depending on the region that you're in, you can make a lot working as a home health nurse practitioner. The second highest paid nurse practitioner would be psychiatric mental health nurse practitioner. And a lot of people might know this, that notice that a lot of nurse practitioners now that are family or adult, they're transitioning to become psychiatric mental health. And the reason is because they start off around 135,000 to 145,000 a year, and they focus on treating, counseling, diagnosing patients with mental health illness, mostly patients with depression, anxiety, and a lot of different mental conditions. So that's what they focus on. As we know, mental health is really big now, so this type of nurse practitioner is in very high demand. The number three nurse practitioner highest paid is emergency nurse practitioner. This specialty can be very, very lucrative because it's fast-paced, it's very intense. You have to have a solid background in order to work as an emergency room nurse practitioner, and it can be very lucrative depending on the region where you live. So this nurse practitioner, they can start off anywhere from 130 and up. The possibilities are endless for ER nurse practitioners. The number four top paid nurse practitioner would be neonatal nurse practitioner. And this type of nurse practitioner, they work mostly with premature and sick babies. Sometimes they can assist with deliveries depending on the type of delivery. And as I mentioned, they work in ICU setting. So this type of nurse practitioner, they can make anywhere from 135,000 and up depending on experience and of course your region where you're located. Number five nurse practitioner would be occupational health nurse practitioner, and they can start off around 135 to 139 according to different sources I've gotten. And this type of nurse practitioner, they focus on providing health and wellness to employees. They focus on pre-employment screening and just making sure that everything is going up in accordance, in a hospital setting, in a nursing home setting. Focus more for the employees, like health-wise. So that, and the opportunities for occupational health, they're endless because every facility needs one. So this can be a very lucrative specialty for nurse practitioners to get into. The number six nurse practitioner would be cardiology or interventional radiology nurse practitioner, and they can make anywhere from 131,000 and up, of course depending on the region. This type of nurse practitioner, they focus on providing care in a cardiology office and working alongside a cardiologist doctor, where they can perform a variety of procedures like stent placement, catheter placements, following up. A lot of patients in cardiology, they have pacemakers, defibrillators. they have to follow up every couple months. So these nurse practitioners, they can work in office settings, they can work in hospital settings, and the opportunity for them is endless. You know, heart disease is like one of the #1 causes of death in America. So I don't foresee this type of specialty going away or being at the bottom. They're definitely going up, and I could see that the earning potential for cardiology nurse practitioners is very high. Number 7 is acute care nurse practitioner. And these nurse practitioners, they can work in intensive care units in the hospital setting, and they mostly focus on adult population, sick adults or people that just came out of procedure or trauma patients. So you got to have a critical care background to do this type of job. And because of this, these nurse practitioners, they can start off around 129,000 and up. The opportunity is endless. I ran through multiple websites and compared the different ones, and I just picked like the top 10, you know, based on all these different websites. Most of them are pretty similar. I'm gonna link them down below if you guys want to check them out. Number 8, top paid nurse practitioner would be aesthetic nurse practitioner. And I'm sure you guys have noticed now, you know, in 2024, beauty, aesthetics, these things are becoming very, very popular, and nurse practitioners are branching out into different specialty. This type of nurse practitioner, they can start anywhere from 130 and up. Opportunities are endless, and they're more focused on providing cosmetic procedures that enhance appearance of patients. They can take care of patients post-operatively during cosmetic procedures. They can work in plastic surgery centers. They can even have their own business doing Botox. I can see this type of nurse practitioner very much being a lucrative specialty, because this is something that's becoming very popular and very common now for this generation. And the number 9 nurse practitioner would be family nurse practitioner. And when we hear nurse practitioner, that's the most common one that we hear, FNP. And these type of nurse practitioners, they're in very high demand, because they pretty much do the same thing as family doctors, if not exactly the same thing. They can work in hospital settings, they can work in clinics and offices. Some of them, they can even have their own practice depending on the state that they live in. And they just provide, they tend to provide primary care to patients and follow-up care. Pretty much exactly what a family doctor does, family nurse practitioners can do as well. And I don't know, I'm sure a lot of you guys may know, like nowadays when you go to do like a physical or a general checkup, you're now pretty much seeing a nurse practitioner. They're pretty much taking over the office settings, and the doctors are kind of stepping back and letting the nurse practitioners take over that role. So I can see this being very lucrative, and the pay can definitely increase for family nurse practitioners. If I didn't mention, they start around 120,000 to 128, but this can go up, of course, depending on experience and the region where they are located. And finally, the number 10 nurse practitioner, this would be a tie between pediatric and adult gerontology nurse practitioner, which is my specialty. And they can make anywhere from 110,000 to 120,000. And this is average starting salary. And of course, it's pretty much the exact opposite. The pediatric nurse practitioner, they focus on caring for babies to 13 years old. And the adult gerontology, they focus on working from 13 years old all the way until end of life. So these are two very important type of nurse practitioners, and depending on, you can be an adult geriatric and you can work in a variety of different settings. Like for me, I work in pain management, so you know, it's not solely like you're just working in adult gerontology, but there can be so many specialties. Like I mentioned, acute care, they focus more on adult patients, but sick patients, patients that are post-procedure. Thank you guys so much for watching this video. If you found this to be helpful, go ahead and hit that like button. Share it if you think it may be helpful to others. And if you have any questions, I want to know what you think about it. Comment down below. Let me know if you're a nurse practitioner, what specialty are you in? What specialty are you considering working? Let me know down below. And don't forget to subscribe to my channel and hit that notification button. Bye.